Hi everyone, I'm Julian. I'm one of the third-year fellows here at Harbor-UCLA, part of the Pulmonology Fellowship Program. I was hoping to give you a sense of a little bit of what daily life here seems like and what really makes this program special and stands out, at least to me, when I selected this program. I think one of the strengths of this program really is that it's set out to ensure that you have a really well-rounded experience throughout the 3 years that kind of fosters your own growth, really as a physician, as a clinician, and then really as a teacher as well.
Hi, my name is Peter. I'm one of the Pulmonary Critical Care Fellows. So currently we have two ICU teams, one COVID ICU team and the other one, the non-COVID ICU teams. Each team is staffed by one attending and one fellow, consisting of one resident for each team and then 2 interns for each team as well too. We have 8 beds in our respiratory unit, but we do have overflows in the neuro ICU, CCU, and surgical ICU as well. Our job here is to really supervise the teams, supervise procedures, and in general give guidance to the residents.
A lot of it is going to be fellow driven, and again that gives you a sense of autonomy and really tests how you do as a clinician. And one of the other strengths of this program too is really the teaching, and that's really from top down. 4 of our 5 attendings right now were prior chiefs, so teaching has really been part of their tradition throughout, and it's really kind of trickled down to the fellows as well. And so that's really valued here, and it's highly coveted here, both teaching from the attendings to ourselves, and then again from us to the house staff as well.
The faculty here really consider fellows as junior faculty, so we run rounds, we do teaching during rounds as well too, with input from the attendings as well. So the procedures that the fellows do in the ICU, the attendings here like us to manage our own airways, so there's a lot of different opportunities to get intubations while on the ICU rotations. We do a lot of thoracentesis, we do a lot of different chest tubes, central lines, arterial lines. We also get an opportunity to perform percutaneous tracheostomies for our patients as well too.
Hi, my name is Sean. I'm one of the Pulmonary Fellows, second year. Consult service is usually run between 2 fellows that are always on service.
Hi, my name is Teresa Yang, and I'm a third-year fellow in Pulmonary and Critical Care here at Harbor-UCLA.
And our duties other than the inpatient consults that we see include our outpatient bronchoscopies, inpatient bronchoscopies.
We do anything from BALs to very advanced navigational bronchoscopies.
Linear EBUS, radial EBUS, as well as sometimes going to the OR for more advanced cases under general anesthesia that we sometimes do in tandem with CT surgery, and including our more advanced procedures with our interventional pulmonary, Dr. David Shaw.
So that ranges really from rigid bronchs to linear EBUS, radial EBUS, regular diagnostic therapeutic bronchoscopies as well. Foreign body retrievals, I think we have it all, and we've been really lucky to have the expertise here to be able to do a lot of these procedures as even first-year fellows, and of course second and third-year fellows too.
In regards to other duties we do have on pulmonary consult service includes chest tube placement,
thoracentesis, indwelling pleural catheter placement,
chest tube, surgical, percutaneous, thoras, all these things were done under the supervision of our attendings too, and it's something that, again, we're at a point where we're not just doing them, we're trying to master them and kind of teach the future house staff as well.
A couple days a week we actually have interdisciplinary meetings. One of them is our tumor boards that we run and manage with our hemonc, CT surgeons, our pathologists, and radiologists, and then we also have our weekly TB kind of discussion.
We also hold a weekly TB conference. We discuss TB cases that are challenging to treat or are due to multi-drug resistant tuberculosis with our public health experts.
I will also tell you guys that we do handle the PE response team, which is essentially a service that was created over the past year and a half. That helps respond to intermediate to high-risk PEs, whether they get thrombolytics or IR-guided procedures or catheter-driven thrombolytics.
And really to wrap everything up, I think the 2 biggest things that make this program special beyond other programs that you may be looking at. One I mentioned before is really the tradition of teaching, but it really goes on beyond that, mainly because the attendings here
the attendings were phenomenal.
They, along with ancillary staff, they are all invested in your growth and your success. And I think throughout training, we're fortunate to meet people like that. But I have never seen the level of investment that our physicians here have in all of us and in our growth throughout the 3 years.
What I've liked a lot about my time here so far is that the patients are county patients. They often don't have any other safety nets for them other than this hospital here.
Since we have such a diverse patient population, we get to see a lot of different pathologies and different ways in which they manifest. And I think helping patients that are underserved and would not be able to get this care elsewhere is also very important to me.
Harbor's been really great about augmenting and supplementing and really creating, again, that well-rounded experience. So in our first year, we do spend time at Long Beach Memorial where we get additional critical care experience, pulmonology experience, and then cystic fibrosis experience as well. And this is kind of a pseudo-academic community feel too, so it's nice to have some practice in that setting.
I do really like the outside rotations, where in Long Beach during your first year, you get to work in private practice and get to take care of people with CF. And at Kaiser and Downey in second year, you start to actually practice on your own with attendings without residents and interns to work with. So it sort of gives you a real world practice and application.
And then also we spend a few weeks under the anesthesia rotation, and that's where we get a lot of our intubations in, and really to make sure that we are not only competent but comfortable doing intubations with difficult airways too. And during our third year, our program directors have actually been able to add on additional liver ICU experience and lung transplant experience over at Ronald Reagan UCLA to kind of round out everything and make this the complete program.
Part of the reason working here is so pleasant is because we're all here for similar reasons. We want to learn and we want to help patients, and we have a very good relationship with each other in and out of the hospital.
So it is a very small program, so you get to know your co-fellows super well. And you have to be kind of really cohesive as a group, and I think we're all kind of pretty laid back and we're a comfortable bunch with each other, so I think we get to know each other pretty well.
The last thing I'll mention too is who you end up working with is really important, and you can go day in and day out and do it and become a good clinician, but if you don't have fun doing it, it's kind of a drag. But I've been very fortunate here. My 7 co-fellows, we are laughing all the time. We're joking all the time, even at 5:30, 6 in the morning. I have people who, as we're getting ready for rounds, the room is all laughter, all music, and plenty of memes. And we have lots of fun here. So I'm looking forward to meeting you guys.